Welcome to the deep dive. Today, we're taking on a really crucial topic. It's about a language our bodies speak constantly, one we often tune out. We're talking about the subtle language of your breasts
Mm.
and understanding it. That's incredibly empowering.
It really is. Our bodies don't use words. They communicate differently through signs, little whispers, shifts that are sometimes, well, almost too subtle to notice easily.
Right. So the big question for you, our listener, is how fluent are you, really, in your own body's language? And this deep dive, it's not about creating panic, not at
Mm.
all. It's about giving you power. It's about building fluency, not fear,
Yeah.
because honestly, your breasts are so much more than just tissue or shape.
Exactly. It's fascinating when you start thinking about them differently, not just as organs, but as these incredibly sensitive barometers.
Right.
Like, imagine a really finely tuned seismograph, picking up tiny tremors from everywhere in your body, from stress, inflammation, maybe from your diet, even shifts in your gut health. They really are storytellers.
Storytellers, I like that.
Yeah, they function like these complex biofeedback loops, almost like hormonal antennas, plugged right into the main grid of your whole inner ecosystem. We often see them in such a narrow way.
Right, just aesthetically or in terms of, basic function.
But they're a hormonal powerhouse, so sensitive to things like estrogen, progesterone, cortisol, insulin, which means they're constantly acting like a sensor, always responding to signals from your lifestyle, your environment, stress, food, your habits, everything. It's like a living record of your overall health.
So when something's a bit off in that system, they try to tell you. Is that the
Uh,
idea? Like a little twinge of pain, maybe a new lump, a texture change, or even like unexpected discharge.
Precisely. It's like getting these subtle text messages from your body.
What do we usually do? We hit read and swipe them away. Or worse, we silence that voice.
Right.
We start normalizing things. You hear it all the time. Oh, that's just hormonal.
Or it's probably nothing serious. That's a common one.
Yeah. Or we just flat out ignore it, hope it goes away.
And that really brings up a critical point, doesn't it? Why do we dismiss these messages from our own biology so often? This deep dive, it's really meant as a wake-up call, but not a scary one. Just be aware, intentionally aware.
Because being aware early on, it doesn't just, save lives from cancer, though
Yeah.
that's obviously huge.
Absolutely paramount. But it goes beyond that. It can help you prevent things like burnout before it really takes hold, or address subtle hormonal issues before they become major problems. Maybe manage autoimmune stuff better, or even start untangling emotional trauma that might be showing up physically.
Wow. So the breast isn't just this isolated part.
Not at all. It's a reflection of your whole body, like a little microcosm of your overall health and well-being.
Okay, so for everyone listening, what's our mission today, specifically?
Our goal is pretty clear. We want to decode the top signs your breast might be sending you. And this is key. Figure out what you can actually do about it.
Right. Actionable steps. We'll be digging into inflammation, that whole hormone dance, lymph flow, which is often overlooked, lifestyle impacts. And, the real reasons behind symptoms we're often told to just shrug off.
The breast is talking. It really is.
And it's definitely time we start listening. Let's dive in.
Okay.
So let's unpack this core idea first, this philosophy of listening. It's based on that old wisdom, right? When the body whispers and we don't listen,
Mm-hmm.
it eventually has to scream.
Exactly. And it's not just a nice saying. It's physiologically true. Our bodies work that way.
So if we can learn to interpret those whispers, the subtle stuff,
Then we don't have to wait for the crisis. That's the huge benefit. It changes everything from reactive to proactive. Think about a chronic fatigue that builds for years before someone finally gets a burnout diagnosis.
or digestive issues that rumble along forever before it's labeled IBS.
Right. These early cues, especially from the breast, they're like sophisticated early warning systems. They give us a chance to intervene, maybe with lifestyle tweaks, nutrition changes, stress reduction, even emotional work, long before the body has to escalate things into a full-blown crisis that's much harder to deal with.
It's not just about avoiding the worst-case scenario then.
No, it's about optimizing your vitality now, maintaining a better quality of life, building resilience for the long haul.
It makes you think about how society kind of trains us not to listen, doesn't it? Especially women, maybe. That whole power through the pain mentality. Ignore the ache. It's just part of being a woman.
That narrative is so pervasive, and it really sidelines our intuition, delays people getting things checked out. It's like we're systematically taught to distrust our body's signals.
Instead of seeing them as valuable data, like an early warning system.
Exactly. A sophisticated biofeedback mechanism. It's giving you vital information. When we ignore that gentle tap on the shoulder, the body has to raise its voice, which often means more serious symptoms.
So it's about shifting from being reactive waiting for a diagnosis to being proactive, engaging with our body's intelligence.
Precisely. That shift from, oh, it's probably fine to, what is my body trying to tell me here? That's the foundation of empowered health. It's about taking back agency.
Okay, that sets the stage perfectly. Let's move on to something really tangible and honestly something that causes a lot of anxiety for people.
Yeah.
Lumps.
Yes. This is where fear can really kick in.
So there's a golden rule right up front.
Don't panic, but absolutely, positively do not ignore it.
That needs to be crystal clear.
Absolutely. Because the vast majority of lumps found, they're benign, not cancerous. We're talking about common things like fibroadenomas or cysts filled with fluid.
So my job, as the person who found the lump, isn't to figure out what it is myself.
No, definitely not. That's for a trained medical professional with the right diagnostic tools. Your crucial job is simply to notice it, acknowledge it's there, and then act on that by getting it checked out properly.
That puts you in the driver's seat, rather than just waiting or worrying.
Exactly. You become an informed, proactive participant in your own health, not just passively waiting, or worse, getting stuck in fear or denial.
Okay, so what kinds of lumps might someone find? What do they typically feel like?
Well, probably the most common are cysts. These are basically fluid-filled sacs. They often feel soft or kind of rubbery, maybe movable under the skin, and their size can really change, sometimes with your cycle.
Okay, so they can fluctuate.
Yes. Then you have fibroadenomas. These are benign, solid lumps made of glandular and fibrous tissue. They usually feel quite firm, smooth, rubbery, and typically very mobile people often describe them feeling like a marble that slips around easily under the fingers.
Like a marble, okay.
Another type is a lipoma. That's simply a benign lump of fat tissue, usually pretty soft and generally painless.
Right. And the one everyone worries about, cancerous lumps. How are they often different?
The characteristics are often quite distinct. A malignant lump is typically described as hard, often feels irregular, not smooth, and crucially, it tends to be immobile, like it's fixed to the surrounding tissue or the chest wall, not sliding around easily. And here's the part that surprises many people. It's often painless.
Painless. That seems counterintuitive.
It does. We associate pain with problems, but that lack of pain can actually lead to delays in seeking help because it doesn't seem urgent. With cancerous lumps, painless is actually quite common.
That is such a critical distinction. Okay, so someone finds any kind of lump. What are the immediate must-do action steps?
First step, non-negotiable. Schedule a clinical breast exam with your doctor or healthcare provider. Get it properly felt by a professional. After that, you need imaging. And for many people, especially if you're under 40, an ultrasound is often the first go-to.
Why ultrasound, particularly for younger women?
Younger breast tissue tends to be denser. Mammograms rely on differences in density, so dense tissue can sometimes obscure things, making it harder to see clearly. Ultrasound uses sound waves and is often better at distinguishing between normal dense tissue and an actual lump or cyst in younger women.
Makes sense. So clinical exam, then imaging. What else?
Keep track of it yourself, document where it is, roughly how big it feels, and notice any changes month by month. This personal record is really valuable for monitoring over time, both for you and your doctor.
And what if it seems linked to your cycle?
Good point. If the lump seems to change size or tenderness with your period, definitely mention that and maybe discuss hormonal testing with your doctor. It could point towards underlying imbalances, maybe estrogen dominance or low progesterone contributing to cysts or other benign changes.
And finally,
advocate for yourself. This is so important. If you're worried, if you feel dismissed, if something just doesn't sit right with you after an initial check, get a second opinion. It's your right. A second opinion might cost a bit of time, maybe some hassle, but regret, that can last forever. Your peace of mind, your health, absolutely worth it.
that's such a powerful message. Be your own advocate.
Yeah.
Okay, from things we can feel inside like lumps, let's shift to something external. Nipple discharge.
Right. And this one, unless you are actively breastfeeding, is almost always your body waving a pretty significant red flag.
A clear signal.
Very clear. Something needs looking into, and that flag gets even redder, more concerning if the discharge isn't clear. So if it's bloody or milky when you're not lactating, or greenish, yellowish, any color, really. Or, and this is also important, if it happens spontaneously without any squeezing or touching of the nipple at all. That's a really distinct message.
So what could be causing it? What are the potential underlying issues?
Well, thankfully, many causes are benign, even though it's alarming. You might have something like ductal issues, or what's called a papilloma. These are tiny, non-cancerous growths inside the milk ducts, like little benign warts in the duct lining. Need identifying, sometimes monitoring.
Okay, benign growths in the ducts. What else?
Hormonal imbalance is a really common one, especially elevated prolactin levels. Prolactin's the milk production hormone, right? So if levels are high when they shouldn't be, it can cause discharge. Often points to a bigger endocrine system issue.
And you mentioned systemic connections before.
Yes. Thyroid problems can definitely show up this way. Your thyroid affects practically everything, including breast tissue. Hyperthyroidism can trigger discharge. And then the less common but important one to rule out, it can sometimes be a sign of cancer within the ducts themselves. Intraductal carcinoma, again, rare, but it absolutely has to be investigated thoroughly.
So noticing discharge, immediate action plan.
See a doctor straight away. No waiting. And when you go, be ready to ask specifically for tests, a prolactin level check, a full thyroid panel, and appropriate breast imaging. That imaging might be ultrasound, mammogram, maybe even an MRI, depending on the specifics.
Anything else to keep in mind while waiting for the appointment?
Yeah, try to avoid stimulating the nipple. You want to see if it's happening spontaneously without interference to give the doctor the clearest picture. Also, take a look at your medications. Review them with your doctor. Some common drugs, certain antidepressants, some blood pressure meds, even some stomach medications can actually raise prolactin levels as a side effect.
Oh, interesting. So it might not even be a primary breast issue.
Exactly. It could be a medication side effect, so you need to rule that out. It's about being thorough, checking all the possibilities.
It really shows how connected everything is.
Okay.
From internal fluids, let's move to the surface, skin changes on the breast. Skin is our biggest organ. When it speaks, we really need to listen.
Absolutely crucial. And any kind of dimpling, puckering, swelling, or a persistent rash around the breast, that's not just a cosmetic thing to ignore, it's a clue. A visible message from your body. We tend to overlook skin sometimes, think it's just irritation, but it can be very telling.
What kinds of things could those skin changes be signaling?
Well, one possibility ties back to something we mentioned earlier, lymphatic blockage. Remember, the lymph system drains waste. If it's blocked in the breast area, fluid can back up. That can cause swelling, thickening of the skin, or that classic peau d'orange, orange peel skin, that dimpled texture. It's a real visual sign of congestion.
Peau d'orange. Okay, I've heard that term.
Then there's inflammatory breast cancer, or IBC. We touched on this briefly. It's aggressive and tricky because it usually doesn't present with a lump. Instead, it shows up mainly as skin changes. Redness, warmth, swelling. The skin might look bruised or feel painful. It can mimic an infection.
Which could lead to delays in diagnosis.
Exactly. That's why it's so important to take skin changes seriously. IBC needs urgent attention. Another possibility is mastitis, an infection in the breast tissue. Common in breastfeeding, sure, but it can happen otherwise. It also causes redness, warmth, pain, swelling, maybe fever, or feeling unwell.
So given how serious some of these possibilities are, what's the action plan for skin changes?
The directive here is unequivocal. Don't wait. Get it checked ASAP, as soon as possible. These signs, persistent redness, heat, swelling, dimpling, could be urgent. Needs rapid diagnosis.
Okay. And while waiting for that appointment, any supportive things someone can do?
Yes, supportive measures only, not treatment. Wear looser bras, avoid underwires, just give the area space, don't constrict it further, especially if lymph flow might be involved. Hydrate really well. Water is key for everything, including lymphatic drainage. And consider cleaning up your diet, adopting an anti-inflammatory approach. Cut out the obvious culprits: refined sugar, processed seed oils, junk food. Now, diet won't cure IBC or serious infection, obviously, but it supports your body's overall healing capacity, reduces background inflammation, and just generally helps your system function better.
It's that whole body approach again.
Right.
Okay, final area. Asymmetry or sudden changes in breast size or shape. We hear breasts are sisters, not twins. Totally normal for them to be a bit different.
Absolutely normal. Most women have some natural asymmetry.
But when does that natural variation cross the line into something to pay attention to?
That's the key distinction. If one breast suddenly noticeably grows larger than the other, or if it seems to lift or tighten up significantly compared to the other side, or if you see a distinct change in the overall contour or shape that wasn't there before, that's not just normal variation anymore. That's new data.
It's the change that matters.
Precisely. It's your body providing new information that needs attention and professional evaluation. You need to compare it to your baseline normal.
What could be behind these sudden changes in symmetry or shape?
Well, often it is linked to significant hormonal shifts. We keep coming back to this, but
Mm.
it's true. Breast tissue is so responsive to estrogen, progesterone. A major shift can change tissue density, fluid retention, overall size, or firmness. Maybe one breast responds more dramatically.
Could cysts play a role here too?
Definitely. A new large cyst, or maybe a cluster of them developing in one breast, can certainly alter its shape or make it look bigger or feel different. And of course, tumor growth can cause these changes, especially if you notice thickening under the skin in a specific area, or really important if you feel changes or lumps in the underarm area too. And that suggests lymph nodes might be involved.
So if someone notices this kind of change, new asymmetry, sudden size or shape difference, what should they do?
First, a simple but useful trick. Look at past photos. Seriously. Our memory plays tricks, and we see ourselves daily, so gradual changes are hard to spot. Photos give objective comparison over time, can be really helpful for your doctor too.
Good idea. What else?
Recommit to doing regular breast self-exams, same time every month. That regular practice makes you intimately familiar with your normal, your texture, your contours. It makes it much, much easier to notice subtle shifts. It's about building that fluency we talked about right at the start, that deep familiarity.
Knowing your own normal.
Exactly. And finally, and this is critical, bring it up with your provider, even if you feel fine otherwise. Just because there's no pain or discharge doesn't mean the change isn't significant. Your observation, that data your body provided, is valid. It warrants a professional look and discussion. Trust yourself.
Trust your intuition. Okay, so wrapping this all up, we've covered a lot. Pain, lumps, discharge, skin changes, asymmetry. What it really boils down to, it seems, is that every sign is like a sentence. Every symptom is a syllable.
In a much larger conversation your body is trying to have with you.
And you, our listener, you're probably fluent in all sorts of complex languages, right? Professional jargon, maybe another language entirely, social cues.
Absolutely. We navigate complex communication systems all day long.
So it's really time, isn't it, to add your body's language to that list? Maybe put it right at the top.
It's arguably the most important language you can learn, because fluency there gives you the power to understand, interpret, and respond effectively to your own health needs. It lets you be proactive, not just reactive. That's real well-being.
So here's a final thought to leave you with. Considering how incredibly responsive your breasts are to your whole inner ecosystem, your stress, your diet, your emotions, everything, what proactive daily habits could you start exploring? What small things could you do to really nurture your breast health consistently at every age? It's not about a quick fix, is it?
Not at all. It's about that consistent listening, day in, day out, tuning into the incredible wisdom your body holds.
Thank you so much for joining us on this deep dive.
Thank you. Welcome to the Deep Dive, where we cut through the noise to bring you the truly essential, making complex ideas clear and actionable. Today, we're diving into a really compelling idea. What if your body is constantly broadcasting vital information, kind of like a radio signal, but, we just haven't quite learned how to tune in properly. So often we're sort of trained to wait for the big alarms, the really obvious signs, but the truth is, sometimes the most important messages are subtle. They're just beneath the surface, really waiting for us to listen. So this deep dive is all about breast health. Specifically, it's about empowering you with the knowledge and, well, the tools to decode these quiet but incredibly important messages your body sends. Our insights today, they're pulled from extensive excerpts from Breast Health, Decoding Your Body's Messages, which is just a fantastic resource, offering a really unique perspective on understanding what our breasts are communicating. Our mission here is pretty clear. Take what might feel like scattered, maybe even a bit alarming, bits of information and turn them into a clear, actionable guide. This isn't about creating fear, not at all. It's really designed to sharpen your own radar,
Right.
and arm you with the confidence that comes from truly knowing your body. Think of it as a shortcut to being proactive, to feeling really in charge of your health.
Exactly.
Yeah.
And it's fascinating, isn't it, how often we're taught to see symptoms almost as a problem, like our body's failing us or working against us, something we need to suppress. But this deep dive really encourages a shift in perspective. What if we viewed these symptoms, these signals, not as problems, but as these incredibly valuable diagnostic gifts? They're essentially your body's early warning system. They offer you these critical chances for timely intervention, for real healing, and ultimately for thriving. So for instance, if you notice, say, a persistent localized tenderness, instead of just dismissing it, maybe thinking, oh, it's just hormonal, or reaching for a painkiller, thinking of it as a gift makes you ask, okay, what is my body actually trying to tell me right here? It shifts you from being passive to being this active, empowered listener ready to respond.
That's such a powerful reframe symptom as ally, not adversary. Okay, so with that foundation, let's dive into those first crucial messages. The signs to never ignore what your breasts are saying beneath the surface. And the theme here is so important because, like you said, breast cancer doesn't always start with an obvious lump. It often begins much more subtly, maybe changes, shadows, just a feeling that's off. So this part isn't about panic. It's about sharpening that radar, right? So we can recognize these quiet signals.
Precisely. And let's start with the one people probably think of first, but it's still got a lot of nuance. Lumps.
Right. Lumps more than just a bump. Okay, so when we say lumps, what exactly should we be on the lookout for? Because not all lumps are the same, are they? What makes one suspicious?
That's a really key distinction. When you're doing a self-exam, you're feeling for specific things. First, does it feel hard? Like really hard, almost like a little pebble or maybe a frozen pea, not soft or squishy. And immobility is another big one. Does it feel fixed, stuck in place? Or does it kind of roll around easily under your fingers, more like a grape? Also, is it new? Is this something you definitely haven't felt before? And does it feel different from the rest of your breast tissue, which might naturally have some lumpiness? And finally, is it just on one side? Or maybe you notice it seems to be growing quickly. Those are the characteristics that really, raise a red flag.
Okay, so hard, immobile, new, different, one-sided, or growing fast. Got it. So if someone finds a lump like that, what could it be? I mean, the mind jumps, right? But there are different possibilities.
Absolutely. And knowing the possibilities helps manage that anxiety. It could very well be a cyst. Those are super common fluid-filled sacs. They often feel, well, soft or maybe round, sometimes tender, and they might change with your cycle. Or it could be a fibroadenoma. It's a benign, solid tumor. They tend to feel smooth, firm, rubbery, and importantly, they're usually mobile. They move easily. Very common in younger women. But yes, it could also be a tumor either benign or malignant. And the tricky thing is, malignant tumors can often be hard, irregular, but surprisingly, sometimes completely painless. That's why pain isn't always the best guide. The bottom line is, you just can't tell for sure by feel alone. You absolutely need a proper medical evaluation.
It's really clarifying. Okay, so you find something concerning. What's the immediate plan? Not panic, but action. What does the source say to do?
Right. Don't panic, but definitely don't ignore it or guess. First step. Document everything. Write down its rough size, pea-sized, marble sized. Where is it exactly? Use the clock face idea, like 2 o'clock, 3 centimeters from the nipple. Describe how it feels to you. Then the crucial next step is to get imaging done promptly. If you're under 40, usually an ultrasound is the first step because younger tissue is denser. Ultrasound is great for telling solid from fluid. If you're 40 or over, a mammogram is typically the standard. Breast tissue tends to get less dense with age, making mammograms more effective there. And this is critical. If the imaging is unclear or if the mass looks suspicious, you must advocate for a biopsy. That's the only way to know for sure if it's benign or malignant. It gives you the facts.
That is such solid advice. And I love how the source puts it. Most lumps aren't cancer, but every lump deserves clarity. Early detection isn't about fear, it's about facts. That just changes everything, doesn't it? Puts you in control. Okay, moving to sign number 2. Something often, well, maybe embarrassing or easy to dismiss. Nipple discharge, your body is speaking. That sounds pretty direct. What kind of discharge are we talking about here?
Yes, this is a signal that really needs attention. The key things to watch for are, is it spontaneous, meaning it happens without you squeezing or anything, maybe you just see a spot on your bra. Then the color's really important. Bloody, clear, like water, or even greenish discharge are definite red flags. Also, milky discharge if you're not breastfeeding or haven't recently been pregnant. And pay very close attention if it's only coming from one breast, or even more specifically, just one single duct opening on the nipple. Those feature spontaneous, certain colors, one-sided single duct. Those really signal, okay, time to get this checked out.
Got it. Spontaneous, specific colors, one side, one duct. So if someone sees that, what could be going on underneath?
Well, there's actually quite a range, which is why getting it checked is key. It could be something like a hormonal imbalance, maybe high prolactin levels, that's the milk hormone. Certain meds or even stress can trigger that sometimes. It might also be something called duct ectasia, basically a blocked or widened milk duct, more common around perimenopause, often benign but needs checking. Or it could be an infection or a small benign growth inside the duct called a papilloma. But, and this is why it's crucial, it can also be a sign of ductal carcinoma, either in situ DCIS or invasive cancer starting in the milk ducts. So we had to figure out which it is.
Okay, quite a spectrum. So what's the action plan if you notice this kind of discharge?
First, observe carefully. Note the exact color, any smell, which side, how often it happens. If it's bloody, clear, or spontaneous happening on its own, the source is really clear. See a doctor right away. And when you go, tell them all those details. Don't hesitate to ask for specific tests. Usually that means checking prolactin levels, maybe a thyroid panel, because that can affect hormones too, and definitely imaging like a ductal ultrasound or a mammogram focused on that area. Your detailed observations are super helpful here.
And that key takeaway really hits home. Your nipple should never bleed without reason. Don't let discomfort or shame silence your intuition. Such an important reminder. Okay, next up. Skin changes the warning signs that show on the outside. Our skin is right there, so visible. What specific changes on the breast skin should we be really aware of?
Yeah, the skin is like a map, isn't it? You're looking for any new dimpling or puckering, like the skin is being pulled inwards, or areas where the skin looks or feels noticeably thickened or kind of leathery. A really specific and critical sign is something called peau d'orange, French for orange peel skin. The skin gets swollen, and the pores look like little pits, exactly like an orange peel. It might also feel warm or red. Also, any unexplained warmth that doesn't go away, persistent redness, or just general swelling of one breast compared to the other. These visual cues need immediate attention.
Peau d'orange, that's a very distinct visual. What could these skin changes mean? Are they always serious, even if you don't feel a lump?
That's a really critical point because, yes, these skin changes can signal something very serious. They might indicate a bad infection like mastitis that isn't getting better, or maybe lymphedema, swelling from blocked lymph drainage. But crucially, these are often the hallmark signs of inflammatory breast cancer, or IBC. It's rare but very aggressive, and it often doesn't present with a lump. The cancer cells block lymph vessels in the skin, causing these rapid changes in appearance and warmth. So these aren't just cosmetic issues. They often point to a really active underlying process that needs urgent investigation.
Okay, urgency sounds key here. If someone sees dimpling, peau d'orange, unexplained redness or swelling, what do they do? How fast?
The advice is incredibly clear. Don't wait. This needs immediate attention. You need an urgent referral to a breast clinic or a specialist, like right away. And you need thorough imaging, usually a mammogram and an ultrasound, maybe even an MRI. They give different views of what's happening. And crucially, like the source says, do not dismiss this, even if there's no lump. With IBC, the skin changes are the main symptom. Acting fast is absolutely vital.
Wow, that really drives home the point. Your skin is a map, and when it starts to change, it's showing you where to look closer. You have to be observant. Okay, let's talk about pain. Breast pain is so common, right? But what kind of pain or burning, especially if it's new or just in one spot, should actually make us pause and think, maybe this is different?
Yeah, pain is tricky because that general tenderness, often linked to hormones, is really common. But we're looking for specific types of pain, like sharp stabbing pain or persistent burning feeling that's clearly in one specific area, not all over. Also, if the pain doesn't follow your cycle, if it's just there all the time or getting worse, regardless of your period, that's different. And any new sensitivity in just the nipple or areola area that wasn't there before. Typical hormonal pain is usually more diffuse in both breasts and cyclical. So, pain that breaks that pattern, that warrants a closer look.
And if someone has that specific, localized, non-cyclical pain, what could be causing it besides just hormones?
Well, it could still be hormonal, maybe sharp estrogen spikes, or it could be a localized infection like a clogged duct causing inflammation. Sometimes it's nerve-related, maybe after surgery or an injury. But, and this is important, that kind of persistent localized pain can also be a sign of an underlying mass or tumor pressing on nerves as it grows. So, while often dismissed, specific pain patterns are a really important alert from your body.
So if you have that kind of pain, what are the first steps? And when do you definitely need to see a specialist?
First, track your cycle carefully alongside the pain. See if there's any correlation. That helps differentiate. You could also try some gentle anti-inflammatory support the source mentions, like magnesium or omega-3s. See if that helps generalize tenderness. But if the pain is persistent, really localized just on one side, or it seems to be getting worse despite trying these things, that's when you absolutely need a specialist evaluation. Don't just live with it and worry.
I love this quote from the source about pain. Pain is a messenger. Don't dull it with painkillers until you've listened to what it's trying to say. That completely changes how you think about it, doesn't it? Okay, another visual sign. Nipple retraction or direction change. Sounds quite specific. What exactly are we looking for here with the nipples?
Yeah, it's like your body doesn't usually just redesign things randomly, right?
Yeah.
So you're looking for one nipple suddenly pulling inward, becoming inverted or flattened when it used to stick out normally. Or maybe you notice a change in the angle or height. Does one nipple now point differently or sit higher or lower than the other? Any new flattening or maybe even sort of folding at the tip of the nipple. These are structural changes, and if they're new, they can be really significant.
What would cause a nipple to suddenly pull in or change direction like that? What's happening underneath?
The biggest concern is an underlying mass or tumor growing near the nipple or in the ducts connected to it. As it grows, it can physically pull on the tissue, causing that retraction or change in direction. Less commonly, it could be scar tissue from a past injury, surgery, or maybe a bad infection that healed with internal scarring. But the key word is new. If you've always had one inverted nipple, that's probably just your normal anatomy. It's the sudden change in a previously outward-pointing nipple that's the red flag.
Okay, so if you notice a new change like that, what should you do?
First practical step, which is smart, is look at old photos if you have them, just to confirm it really is a new change, because sometimes we don't notice slight asymmetries that have always been there. Then, definitely get imaging right away, specifically an ultrasound or mammogram focused on that nipple area, maybe even an MRI sometimes. They need to see what's going on underneath. And if imaging shows anything suspicious, like pulling or a mass, the source is very clearly, push for a biopsy. It's crucial because sometimes the cause is subtle and needs that closer look.
It's like your body is literally pointing to something. Your body doesn't make design changes by accident. If your nipple suddenly flips the script, it's time for a closer look. Powerful way to put it. Okay, final sign in this section. Rashes or itching that won't go away, specifically on the nipple or areola. Rashes happen, itching happens. What makes it a concern in this particular spot?
Right, it's about persistence, location, and how it responds to treatment. You're looking for redness, maybe some flaking, or just a really stubborn itch right on the nipple, or the darker skin around it, the areola that just lingers, or maybe the skin starts to break down, get crusty, or even weep a little. And the absolute key is if it doesn't get better with typical treatments like hydrocortisone cream for eczema, or antifungal cream if they suspect yeast, or even antibiotics, if it just hangs around despite that, that's a major signal.
So a persistent, non-responsive rash right there on the nipple, what could be causing that?
Well, it could be something straightforward, like eczema or contact dermatitis, maybe from laundry detergent or a new bra. Or it could be a fungal infection. But what everyone needs to be aware of is Paget's disease of the breast. It's a rare type of cancer that starts in the milk ducts and spreads to the skin of the nipple and areola. And the tricky thing is it often looks exactly like eczema or a simple rash, just a red, scaly, itchy patch. That's why it can easily get misdiagnosed or dismissed, delaying treatment.
Wow, okay. So how do you make sure you don't miss something serious that looks like something simple? What's the plan?
The source strongly advises seeing both a dermatologist and a breast specialist. Get both perspectives. The dermatologist can rule out common skin stuff, and the breast specialist can look for underlying breast issues. And if that rash doesn't clear up significantly within, say, 2 weeks of trying standard treatments, you absolutely need to ask for a biopsy of the affected skin. Because Paget's can hide, looking like eczema, you don't let it hide. A biopsy is the only way to know for sure.
That is such a clear distinction. A rash on your leg, maybe nothing. A rash on your nipple that doesn't go away. That's something. Really highlights the importance of location and persistence. Okay, wow. This whole segment really drives home that these aren't just random symptoms. They're like stories, direct messages from your body. And learning to read them, that's a superpower, right? It's about becoming an expert on yourself. And that quote is so empowering. Don't let anyone dismiss what you feel. You are the expert on your body. You are the front line, and you deserve answers. You have to trust yourself.
Beautifully said. And it leads perfectly into our next thought. We often feel like our body is betraying us when symptoms show up, don't we? Like it's failing. But what if we flip that? What if that pain, that lump, that skin change isn't failure, but your body actually begging you to listen? It's working hard, using its signals to protect you, to tell you something needs attention. These signs aren't just warnings of doom. They are those diagnostic gifts we talked about. The sooner we learn to see them not just as isolated problems, but as clues to deeper imbalances, the sooner we can act, heal, and really thrive. And that reframing takes us right into our next segment. Understanding the root causes why your body is pulling the fire alarm.
That's a huge shift from fighting the symptom to understanding the reason for the alarm. Okay, so let's look deeper. First up, hormonal chaos when estrogen takes the wheel. This feels foundational for so many women. What's the basic science here?
It really is foundational. Breast tissue is incredibly sensitive to our main female hormones, estrogen and progesterone. When estrogen levels get too high compared to progesterone, we call that estrogen dominance. It can really impact breast health. Estrogen basically tells cells to grow, to proliferate. Progesterone often acts as the counterbalance, telling cells to mature, differentiate, kind of keeping that growth in check. So when estrogen is dominant, you get this unchecked growth signal in the breast tissue.
And how does that estrogen dominance actually show up? What are the common breast symptoms it causes?
You see it directly in things like chronically lumpy breasts, that dense, irregular feeling. Persistent breast tenderness is a big one. And fibrocystic changes, which are super common, that ropey, granular texture, maybe distinct lumps that come and go. While those are benign, they can sometimes make it harder to feel a new lump. And crucially, long-term estrogen dominance is also linked to a higher risk of breast cancer. So these aren't just annoyances, they're signals of this underlying imbalance.
So what drives this estrogen dominance? What are the main culprits in our lives?
Several big factors. Chronic stress is huge. When you're stressed, your body makes more cortisol, often at the expense of progesterone. It's called the pregnenolone steal, basically stealing the building blocks needed for progesterone to make stress hormones instead. Then there's exposure to xenoestrogens, synthetic chemicals and plastics, like BPA, pesticides, even fragrances and parabens in cosmetics that mimic estrogen in our body, adding to the load. Hormonal birth control can also contribute for some. Poor liver function's another key piece. Your liver has to detoxify estrogen. If it's overloaded from, say, toxins or alcohol or lacks nutrients, estrogen doesn't get cleared properly and can recirculate. And finally, conditions like PCOS, which often involves insulin resistance and thyroid imbalances, they mess with overall hormone regulation too. It's all interconnected.
Wow, it really is all connected. So the takeaway is, if your hormones feel off, your breast might be the first to tell you. And the goal isn't just symptom relief, it's rebalancing the whole system by addressing those roots. That's a big shift. Okay, next cause. Toxin buildup when the lymph system gets stuck. We hear about lymph, but what does it actually do, especially for breasts?
Think of your lymphatic system as your body's internal sanitation department, its drainage and recycling system. It's a network of vessels running alongside your blood vessels, collecting waste fluid lymph from your tissues. This fluid contains toxins, cell debris, excess fluid, immune cells. And here's the key for breasts. Breast tissue is packed with lymphatic vessels. Major drainage routes run right through the breast and into the armpit nodes. But unlike blood, which has the heart pumping it, lymph has no pump. It relies on movement to flow.
No pump. Okay, so what happens if it doesn't flow well, especially around the breasts? If it gets stagnant?
Exactly. If you get stagnant, maybe because you're not moving enough, you're dehydrated, or there's a lot of inflammation that waste fluid backs up in the tissues. In the breasts, this backup, this congestion, can cause swelling, tenderness, maybe even contribute to cyst formation. It's like a traffic jam in the body's waste disposal system right in that area. Pressure builds, things get inflamed. Not a healthy environment.
Makes sense. So what kind of things in our daily lives tend to block up that lymphatic flow? What are the root causes?
Several common things. Just being inactive is a big one. Muscle contractions are what pump the lymph, so sitting all day lets it stagnate. Surprisingly, tight bras, especially underwire ones, can physically compress those delicate lymph vessels in the breast and armpit area, hindering flow. Dehydration is huge. Lymph is mostly water, so if you're dehydrated, it gets thick and sluggish. And if your main detox organs, like your liver and gut, are overloaded maybe from a poor diet or environmental toxins, they create more waste than the lymph system can efficiently clear, causing a backup.
That analogy really clicks. Your breasts are surrounded by lymph. If that system can't flow, pressure builds up and symptoms rise to the surface. Makes perfect sense. Okay, now something we control daily. Inflammatory diet and lifestyle fueling the fire. How specifically does what we eat impact our breasts and hormones?
Oh, profoundly. The science is really clear here. Diets high in refined sugar, too much alcohol, unhealthy processed fats, and critically low in fiber,
Yeah.
these directly fuel systemic inflammation throughout your whole body. And this isn't just about weight. This type of diet messes with your gut health, which affects everything from nutrient absorption to toxin removal. It drives insulin resistance, which throws hormones off balance, and it directly interferes with how your body processes and gets rid of estrogen. You're basically creating an internal environment that promotes imbalance and inflammation.
So what are the biggest dietary culprits we should be aware of? The things that really drive that inflammation and hormone disruption affecting breast health?
We're looking at a few key patterns. Frequent sugar spikes from obvious sources like soda and candy, but also hidden sugars in processed foods. They fuel inflammation and mess with insulin and hormones. Low fiber diets are a major issue. Fiber is crucial for binding to estrogen in the gut so it can be excreted. Without enough fiber, that estrogen can get reabsorbed back into your system, increasing your load. Alcohol, even moderately, has estrogenic effects and burdens the liver, which needs to detoxify hormones. If the liver's busy with alcohol, it might not handle estrogen as well. And then there's the overload of omega-6 fats from processed vegetable oils, corn, soy, sunflower oils, they directly promote inflammatory pathways. We need a much better balance with anti-inflammatory omega-3s. So it's way beyond just calories, isn't it? What's the core message about food here? Absolutely.
Yeah.
The core message is powerful. Your fork isn't just feeding your hunger. It's feeding your hormones. Your symptoms aren't random. They're biochemical feedback. Every meal is a chance to either calm inflammation and support balance or fuel the fire. It's direct feedback.
And the last root cause. Early signs of chronic illness when the breast is the canary in the coal mine. This sounds intriguing, breast symptoms as an early warning for bigger issues. How does that work?
Yeah, it's fascinating. In some cases, because breast tissue is so responsive to hormones and inflammation and has such rich lymphatic drainage, breast symptoms can actually be the first noticeable sign of a deeper systemic condition affecting the whole body. Like the canary warning miners, the breast is flagging an issue before it's obvious elsewhere.
What kind of systemic illnesses might show up first with breast symptoms?
It could be things like autoimmune diseases, lupus, thyroid conditions like Hashimoto's, other connective tissue disorders. The body's confused immune system can cause inflammation in the breast tissue. Of course, breast symptoms can be the first sign of breast cancer itself, which, while starting locally, is fundamentally a systemic disease. And sometimes, breast symptoms can just reflect widespread chronic inflammation that's driving other health issues throughout the body.
So, if someone suspects their breast symptoms might be part of a bigger picture, what other clues or health indicators should they consider?
You'd look at the whole cluster. Are you also experiencing things like unexplained, deep fatigue, chronic joint pain or muscle aches, any significant changes in your periods? Also, consider your family history, any strong history of autoimmune disease. And if you know you have specific genetic risk factors, that might also play a role. It's about connecting the dots across your whole system, not just looking at the breast in isolation.
That's such an important point. Sometimes the breast is the first one to raise the red flag. That doesn't mean disaster. It means a chance to catch it early. It's an opportunity, not a verdict. Okay, so we've decoded the signs, we've understood the roots. Now the crucial part. Knowing all this isn't about making you anxious. It's meant to make you powerful. You're not powerless here. You have more control than you think. This brings us to our final segment. Empowering action, what you can start doing today. Practical, real steps for you, our listener.
Exactly. This is where knowledge turns into action. Tangible things everyone can do starting right now to support their breast health and respond confidently if something changes. It's about consistent, informed habits.
Let's start with the foundation. Do breast self-exams once a month, same time. Why is this simple practice still so vital?
It's incredibly vital because statistics show a large number of early breast cancers are actually found by women themselves during self-exams. Consistency and knowing your own body are key. The recommendation is once a month, around the same time each month, so you really learn what's normal for you.
Okay, and how should someone actually do it effectively? What's the technique?
Good question. The best timing is usually 5 to 7 days after your period ends. Hormones are lowest, breasts are least tender or swollen then. For technique, use the pads of your middle 3 fingers. Use varying pressure light, medium, firm, and small circular motions. Cover the entire breast area, all 4 quadrants. Think of it like quadrants or wedges of a pie. Go all the way up to your collarbone, down below the breast crease, and definitely into your armpit. Lots of lymph nodes there. Check both visually in a mirror looking for dimpling, skin changes, nipple changes, and lying down. Lying down flattens the tissue, making it easier to feel deeper. Your focus is simply noticing any changes from your normal lumps, texture, discharge. I like how the source puts it simply. You don't need a medical degree. You just need a mirror, your hands, and a monthly reminder to check in with yourself. Makes it feel totally doable. Okay, next action. Track your cycle and symptoms. We track periods maybe, but why track symptoms alongside the cycle for breast health? What do we gain? Because those hormone-driven changes, which can feel random, usually follow predictable patterns unique to you. Tracking helps you see your pattern clearly. It helps you distinguish normal cyclical stuff like maybe you always get tender the week before your period from something new or different that falls outside that pattern. It gives you invaluable data about your own body's rhythm.
How can people practically do this? Any tools or specific things to track?
Yeah, there are great apps like Clue, Flow, MyFlow, or just a simple notebook works fine. Track specific things, breast tenderness, where, how intense, swelling, any discharge, any lumps you feel, even if they come and go. But also maybe mood, fatigue, digestion, changes around your cycle. After just 2 or 3 months, patterns usually emerge. And that data is gold when you talk to your doctor.
Right.
It shows what's normal for you and makes changes much clearer.
It really turns your cycle into a personal diagnostic tool. as the source says. Your body runs on rhythms. Tracking those rhythms helps you spot when something's off and why. Makes total sense. Third action. Know you're normal, not someone else's. So important. Why is knowing your personal baseline absolutely key?
Because everybody is different. No two breasts are the same, even on one person. One might always be bigger or lumpier. Knowing your unique normal is crucial so you can spot deviations from that baseline. What's normal for your friend might be a red flag for you, and vice versa. It reduces anxiety about normal variations and helps you hone in on actual changes.
How do you get to know your normal really well? Any tips besides the monthly exam?
Really pay attention during those exams, maybe even take notes or sketch little diagrams in a journal of where you typically feel lumpiness. Some people find taking occasional photos helpful for tracking visual changes over time. Build that personal reference map. And crucially, trust your gut. If something just feels off to you, even if it's vague, don't dismiss it. That intuition is powerful.
And that reminder is key. Just because your friend had a lump and it was fine doesn't mean you should ignore yours. Know you're normal. Essential advice. Okay, this next one is huge. Demand better healthcare, be your own advocate. This tackles a really frustrating reality for many women, doesn't it? Why is self-advocacy so critical here?
It's incredibly critical because, unfortunately, women's concerns, especially about breast health, can sometimes be dismissed too quickly. You might hear, oh, it's just hormones, or it's probably nothing, let's wait and see, without a thorough check. And that delay, if there is something serious going on, can have really significant consequences for treatment options and outcomes. You absolutely have the right to be taken seriously and investigated properly. Your health depends on it.
So if you feel dismissed or you're not getting the answers you need, what can you actually do? What are the advocacy steps?
If you find something concerning, state your case clearly and calmly and insist on appropriate imaging, ultrasound, mammogram, whatever is indicated. If your doctor waves off your concerns without adequate investigation or you just don't feel heard, get a second opinion. Absolutely. See another doctor, a specialist, go to a dedicated breast center, you're entitled to that, and keep records. A symptom journal, photos if relevant, notes from appointment dates, who you saw, what was said. That documentation is your power when you need to push for answers.
That call to action is so vital. You deserve to be taken seriously. And if you're not, keep asking, keep pushing. Your life is worth the noise. Wow. So important. Okay, let's talk about proactive support. Support with nutritional healing. How can specific nutrients help optimize breast health?
Nutrition plays a fundamental role. Specific nutrients are key players in regulating hormones, supporting the body's detox pathways, and calming inflammation, all absolutely crucial for healthy breast tissue. It's not just extra, it's foundational.
What are some key nutrients or foods people should focus on?
Okay, magnesium is really important. It helps the liver process estrogen properly, and many women are low. Glycinate or citrate forms are usually well absorbed and can help with PMS symptoms too. Iodine is interesting. Breast tissue needs it, possibly for protection. But you need to be cautious. Too much can be harmful, especially with thyroid issues. So the source stresses. Never supplement without testing your thyroid first and talking to a knowledgeable practitioner about a low dose, if appropriate. Omega-3 fats from flax, chia, walnuts, fatty fish are powerful anti-inflammatories. They help balance out those pro-inflammatory omega-6s we talked about. And cruciferous vegetables, broccoli, kale, cauliflower, Brussels sprouts, absolutely vital. They contain compounds like I3C and DIM that directly help your liver metabolize estrogen safely and efficiently. Aim for them daily.
It really shifts the view of food. Food isn't just fuel, it's feedback. When you nourish wisely, your breasts respond. Makes you think differently about your plate. And finally, action number 6. Stimulate lymphatic flow, keep things moving. We know it gets stuck. How can we actively help it flow better, especially around the breasts?
Right, since lymph doesn't have a pump, we need to help it along. Stagnation means waste buildup, which isn't good. We need to get things moving.
What are some simple, practical ways to do that?
Several easy things. Dry brushing before a shower, use a natural brush. Gentle strokes towards the heart stimulates the surface lymphatics. Rebound, bouncing on a mini trampoline, even just jumping jacks is fantastic. That gentle up and down movement is like a whole body pump for the lymph. Gentle breast massage, light circles clockwise, no pain, can directly help move stagnant fluid in the breast tissue. And just daily movement. Walking, stretching, yoga, dancing, any muscle contraction helps push lymph along. Even deep breathing helps.
It comes back to that simple truth. Your body was built to move, and when you move, it drains, detoxes, and heals. Using our body's own design. We have covered so much today, from decoding those subtle signs, understanding the deeper roots, and now these practical steps. It really shows that breast health isn't just luck. It's about, well, Literacy, body literacy, understanding the signs, tracking your cycles, eating with purpose, moving with intention.
Exactly. And the hope is that by embracing this, you shift from feeling maybe fearful or reactive to feeling truly informed and in charge. Your body isn't the enemy. It's your greatest ally, constantly communicating, offering those diagnostic gifts.
So the final call to action is simple but profound. Start now. Don't wait until something feels wrong. Start today. Because you are absolutely worth protecting. Today we decoded the messages from your breasts. But think about this. What other hidden signals might your brilliant body be sending you in subtle ways? Signals you might be missing. And how can you commit starting right now to listening more intently with more curiosity to all of them? Thank you for joining us for the deep dive. We'll see you next time.
Welcome to the Deep Dive. Today, we've really dug into a stack of, well, quite compelling sources on breast health articles, some research, insights that are honestly vital and often not really spoken about.
That's right.
Our goal, like always, is to sift through it all and help us, you listening, and us here, uncover the most impactful bits, the surprising facts, really, to become truly well-informed on something that touches, well, countless lives globally. Let's just be candid for a second. All around the world, when we talk about breast health, there's often this deep, unsettling silence. And it's not because people don't care, not at all. It's more from these deeply ingrained cultural norms, you know, things that push modesty, privacy, and this reluctance to make a fuss about something so personal.
Yeah, that's a huge factor.
But here's the stark reality, and it's tough. It really is. This silence. It can be absolutely deadly.
And that stark truth is exactly why this deep dive is, well, so incredibly crucial. Our mission today isn't just to cover the clinical facts of breast health. Many of you probably know the basics already. We're aiming to pull apart the really complex layers that surround it, those pervasive cultural barriers that literally dictate how we even see our own bodies, the frustrating systemic blind spots that, exist within healthcare, and those persistent societal myths that too often get in the way of real understanding and decisive action.
Exactly.
Our goal is basically to give you a shortcut to being properly informed, pulling out the most important insights from these sources so you're not just knowledgeable, but actually feel empowered.
Precisely. Think of this as like your pathway to understanding not just the what of breast health, but the really profound why behind the challenges, the practical how we might address them, and crucially, the empowering what now that turns knowing things into actually doing something. We've carefully gone through some incredibly insightful sources for this chat, and our commitment is to distill every single important piece of information so you feel genuinely equipped with critical, potentially life-saving knowledge.
It's all about giving you the insights to navigate this whole landscape, really, starting with those walls, the ones that are often invisible, but wow, incredibly powerful barriers that stand in the way.
Okay, so let's start by tackling what our sources call the invisible wall, this really profound yet often unspoken shame barrier around breast health.
Yeah, it's a big one.
In so many cultures, I mean, practically everywhere, talking about breast symptoms isn't just, politely avoided, it's actively suppressed, treated like these intensely guarded secrets.
Definitely.
And it shows up in ways that are deeply concerning, much more than just feeling a bit awkward. We're talking about a really intense, almost gut-level embarrassment people feel. Embarrassment about even mentioning localized pain in their breasts, or maybe some nipple discharge, or even the basic empowering act of touching their own body for a self-exam.
It's fundamental, isn't it? That basic self-knowledge.
It is. And this whole phenomenon makes us ask that really poignant fundamental question our sources put out there. How can we protect what we're too ashamed to even name? It's a critical point to really grapple with, because if something's totally off limits for discussion, how can it ever be a priority for care?
That question just cuts right to the heart of it, doesn't it? And a critical insight here is understanding the deep societal and cultural roots that actually foster this shame. It's usually not just one person feeling shy. It's often a powerful collective thing, a societal norm.
Right, like it's expected.
Exactly. Take modesty, for instance. It's deeply valued and beautiful, really, in many cultures. But our sources show how this can maybe inadvertently lead to this profound reluctance to expose or even just frankly discuss parts of the body seen as private, especially, in a doctor's office.
I can see that.
We've seen documented cases where a woman might feel so bound by these modesty norms that she'd rather just suffer in silence. Maybe she tells herself a lump is nothing, or even blames it on something spiritual rather than let a male doctor examine her or even talk about it openly with a female relative.
That's heartbreaking.
It is. And this isn't just a passing discomfort. It becomes this deeply ingrained cultural rule that actively delays critical care.
Yeah.
And similarly, the idea of privacy can be so strict that it stops open conversation even within the closest family circles or with doctors you trust. Symptoms that could be dealt with quickly are instead just endured alone.
In isolation.
Exactly. And then you have traditional beliefs, which in some communities can play a really big role, sometimes attributing illness to fate or spiritual imbalance or maybe even a curse, instead of encouraging proactive self-care or getting timely medical help. These cultural underpinnings, while often coming from, well-meaning values, they accidentally put up very real, very insidious barriers to essential life-saving health practices.
And if we kind of zoom out and look at the bigger picture, the consequences of this widespread silence aren't just severe, they are, well, heartbreakingly tangible.
Absolutely.
When people are too ashamed or too scared or just too culturally conditioned to speak up about a breast symptom, there's this inevitable, often really long delay in diagnosis.
That delay is crucial.
It's not a minor thing. It's this critical window of opportunity that just gets lost.
Yeah.
Our sources are crystal clear. This delay lets diseases like breast cancer progress, often to a much deeper, more advanced stage.
Which makes treatment so much harder.
Exactly. By the time symptoms are finally acknowledged,
Yeah.
by the time someone works up the courage or is forced by worsening pain to get medical help, the disease can be way more aggressive, significantly harder to treat, and tragically, far more likely to have spread, metastasized.
Mm-hmm.
It dramatically cuts the chances of successful treatment and ultimately leads to a much greater loss of life. The silence, basically, it buys the disease precious, deadly time.
That's a powerful way to put it. Deadly time.
And what's truly striking is that this isn't some isolated problem, stuck in a few remote corners of the world. Our sources really highlight just how widespread and universal this is.
It's everywhere.
They show this devastating reality, with examples stretching from vibrant communities all through the Caribbean, where maybe cultural reluctance around personal health is common, to the deeply rooted traditions in South Asia, where maybe family honor and modesty can overshadow individual health needs.
Different contexts, same barrier.
Precisely. We see it from the ancient lands of North Africa, where traditional healers might be the first stop before modern medicine, all the way to even smaller, seemingly more modern towns and rural areas in the West, where maybe access to specialized care or just ingrained personal modesty can also create barriers.
Even in the West, yeah.
Yeah, despite this incredible diversity in geography, in socioeconomics, and specific cultural practices, the damaging outcome of this shame and silence, it remains tragically consistent right across the board. It truly is a universal challenge with universal, devastating consequences.
Which brings us to a really crucial point of reflection for you, listening right now. We really want to invite you to think about this. How might cultural norms, or even just deep-seated personal discomfort, subtly influence your own approach to health discussions or exams?
That's a good question to ask ourselves.
Maybe it's a hesitation to bring up something sensitive with your doctor. Or maybe avoiding consistent self-checks. Or even just quietly dismissing a symptom that feels, too private to share.
Yeah.
Acknowledging this barrier, recognizing its insidious power within yourself or maybe your community, that is genuinely the first, most vital step toward dismantling it. It's about seeing that the greatest power silence has is its ability to stay hidden, unseen.
Okay, so moving from those really critical cultural barriers, let's shift gears to a systemic blind spot our sources call the age paradox. And honestly, this one is genuinely frustrating.
It really is.
For decades, the common practice, the widely accepted norm for breast cancer screening, especially mammograms, has usually started around age 50. That's been the standard protocol, right?
Yeah.
The age where the system generally says, okay, now it's your turn to start routinely worrying about this.
That's the established guideline, yeah.
But here's the critical countertrend that really needs our immediate attention, something our sources are highlighting with, like increasing urgency. There is a rapid and alarming rise in breast cancer diagnoses among women under the age of 40.
A very noticeable increase.
This isn't just a small uptick, it's a significant shift as who's getting diagnosed. And what makes this even more concerning is the nature of these younger onset cancers. They tend to be significantly more aggressive than the ones diagnosed in older women.
That's a key finding.
So we're looking at a healthcare system kind of designed for one reality, now struggling with a rapidly emerging and frankly more dangerous new reality.
Yeah.
What specifically can you tell us makes these younger onset cancers often so much more aggressive?
Yeah, that's a vital question, and diving into the specifics here, based on our sources, really helps frame the challenge. These younger onset cancers aren't just vaguely more aggressive. They often show up as specific, more challenging subtypes.
Okay.
For instance, a really significant chunk of them are identified as triple negative breast cancer, or TNBC. Now, for anyone unfamiliar, TNBC means the cancer cells lack estrogen receptors, progesterone receptors, and don't have an excess of the HER2 protein.
Right, I've heard of that.
And what that means practically is that it won't respond to many of the common, very effective hormonal therapies or the HER2 targeted drugs that are, workhorses for other types of breast cancer.
So fewer treatment options.
Exactly. Treatment often relies more heavily on aggressive chemotherapy. Plus, TNBC typically grows faster and has a higher risk of coming back after treatment.
Well, okay.
And beyond TNBC, younger women can also present with more lobular cancers or aggressive forms of HER2 positive cancers too. And add to that the natural hormonal fluctuations and typically higher breast density in younger women. That can actually mask tumors on mammograms, making detection harder in the first place, potentially adding to diagnosis delays.
So it's biology and the system combined.
It really is. It creates this kind of perfect storm.
And what's fascinating in a grim way is how this systemic blind spot turns into a very personal, often devastating experience for these younger women.
It does.
Our sources highlight that many younger women who start showing symptoms, maybe it's a new lump of persistent pain, nipple discharge, they're unfortunately dismissed or overlooked by the healthcare system itself.
Yeah, brushed off sometimes.
The assumption, which our sources clearly state is deeply flawed and dangerous, is often that they are just too young or too healthy to be at risk for breast cancer. This dismissive attitude isn't just a small error. It means crucial time gets lost. What could be an early treatable cancer is allowed to grow, to progress to a more advanced stage, simply because of this pervasive age bias within the medical world, and maybe even among patients themselves.
That lost time is everything.
Our sources give us such a powerful, really vivid example of this disconnect. It's a scenario that just brings it home. They paint this picture. You could be 29, vegan, doing yoga 5 times a week, and still miss the signs because the system told you it wasn't your turn yet. I mean, how many of us have heard variations of that? Just eat well, exercise, you'll be fine. That example just hits hard, doesn't it?
It really does.
Yeah, it completely challenges that deeply ingrained belief system. Here you are, embracing this lifestyle we associate with peak health, really consciously taking care of yourself, and yet the very system that's supposed to protect you has a protocol or maybe an implicit bias that basically says, nope, wrong age group, move along.
Yeah.
It perfectly captures that devastating gap between how healthy someone seems or feels and their actual emerging risk.
Yeah.
It leaves people feeling unheard and, frankly, unprotected.
And that feeling of being unheard, it connects directly to the bigger picture here. It becomes super clear that this isn't just, a simple medical oversight or a few isolated diagnostic mistakes.
It's bigger than that.
Oh, much bigger. This situation points to way deeper systemic issues within healthcare. Our sources are very clear. This is fundamentally about visibility. Are we truly seeing and acknowledging the changing demographics of who gets breast cancer? Is the data being collected and analyzed in a way that actually reflects this alarming trend instead of just relying on older models?
Good question.
And it's profoundly about equity, too. Equity in healthcare access and attention. Are younger women getting the same level of scrutiny, the same proactive care, the same thorough diagnostic workups when symptoms pop up, regardless of their age?
Seems like maybe not.
And maybe most critically, it's about urgency. The urgent need for updated clinical protocols, for a fundamental shift in mindset within the medical community to catch up with these current realities. The slow pace of change here is frankly a direct threat to younger lives.
That's a strong statement, but it feels accurate.
And these systemic gaps, they can lead to really profound feelings of betrayal, deep frustration, even a sense of real injustice for individuals.
Can imagine.
Imagine doing everything right for your health, believing you're taking all the steps, only to be dismissed when real alarming symptoms show up. That experience doesn't just delay diagnosis, it erodes trust in the whole healthcare system. It leaves people feeling unheard, disbelieved, and ultimately, unprotected. It really highlights a critical need for the system to catch up, to evolve, to not just treat disease, but to truly see and listen to every single patient, no matter what their perceived risk category is.
Which brings us to a really vital point for you listening. And this one is, well, it's non-negotiable. We really encourage you to be an unwavering advocate for yourself or for your loved ones, especially when it comes to health concerns. Doesn't matter your age, doesn't matter how healthy you think you are.
Absolutely crucial.
It's so important to listen intently to your own body. If concerns come up, if something feels off, if a symptom just sticks around, push for a thorough examination. Don't let an age-based protocol or maybe a dismissive attitude from a doctor silence your intuition.
Don't be afraid to push.
Exactly. This might mean asking for specific tests, definitely seeking a second opinion if you feel you need one, or even bringing research like the kind we're discussing to your appointment.
Yeah.
Your body often gives signals, right? Paying attention to those signals and demanding proper investigation, it could truly make all the difference. It could potentially save a life. Okay, let's dive into something I think many of us probably believe, or at least, really hope is true. This idea that maintaining a healthy lifestyle acts like this complete bulletproof shield against serious diseases like breast cancer.
The magic shield idea, yeah.
Right. It's a comforting, really widespread misconception. This notion that if you just eat your greens, hit the gym regularly, live clean, you're somehow immune. It gives us a sense of control, which feels good. But is it actually accurate? Does it tell the whole story?
Well, that's a really important thing to unpack, and I imagine for many listening it might feel a bit confronting, especially if we've always thought our health was totally within our control.
Right.
The profound insight from our sources isn't that lifestyle doesn't matter, because it clearly does for overall well-being, reducing risks for lots of chronic diseases. The real truth, though, is that a healthy lifestyle is simply not a guaranteed shield against breast cancer.
Okay, so not bulletproof.
Not at all. To put it plainly, it's a critical piece, absolutely. But ignoring the equally powerful and often less controllable roles of genetics, hormones, and environmental factors, that creates a really dangerous blind spot even for the most health-conscious people out there.
So there's more to it than just diet and exercise.
Much more. Our sources make it clear that the interplay between all these factors is way more intricate than just eat well, live long. Let's dig into those other critical determinants a bit. First, genetics.
Right, like BRCA genes.
Exactly. While many people think of BRCA1 and BRCA2, which actually account for only about 5–10% of breast cancers, there are lots of other genetic predispositions. Some are well known, others are still being researched, but they can significantly increase risk. And even more subtly, there are also spontaneous genetic mutations that can just happen during your lifetime, totally separate from inherited risk or even lifestyle. They're basically random cellular mistakes that can kick off uncontrolled cell growth.
So random chance plays a part.
A significant part. You can't eat clean your way out of your genetic code or random mutations happening.
That makes sense.
Then you have the really complex role of hormones. The hormones our own bodies produce, like estrogen and progesterone endogenous hormones. They're known to fuel certain kinds of breast cancers. Things like starting your period early, going through menopause late, using hormone replacement therapy, or even having dense breast tissue can influence your lifetime exposure to these hormones, and that increases risk.
So things largely outside our control again.
Often, yes. And this connects to environmental influences, too. And we're not just talking about obvious pollution like smog. Our sources point to a whole array of endocrine-disrupting chemicals, EDCs, found in everyday products.
Like what kind of things?
Well, things like phthalates and BPA and plastics, certain pesticides used in farming, parabens in cosmetics, various industrial chemicals. These EDCs can actually mimic or interfere with the natural hormones in our bodies, potentially contributing to cellular changes that might lead to cancer.
Why, they're everywhere.
They really are. Even fine particulate matter from air pollution has been linked to increased breast cancer risk in some recent studies. So it's this complex web where your personal choices are really only one strand.
This leads us to a really crucial point, one that challenges a lot of deeply held assumptions, especially maybe in communities that prioritize wellness, spirituality, or natural living.
Right, the holistic communities.
Exactly. Our sources delve into this often overlooked reality. Even people who are deeply committed to spiritual practices, holistic approaches, strict natural living lifestyles, the ones who juice daily, meditate, do yoga, embrace every clean living idea, they can, and sadly often do, still get breast cancer.
It happens. It definitely happens.
And this isn't some flaw in their commitment or a failure of their chosen path or some personal moral failing. But yet, these individuals can face immense societal pressure or this powerful internal struggle, feeling like their illness somehow contradicts the lifestyle they've so carefully chosen.
Like they did something wrong.
Yeah, exactly. There's this unspoken expectation, isn't there, that if you live right, you won't get sick. And when you do, it can feel deeply isolating and profoundly confusing. It might even lead to self-blame or maybe delaying seeking conventional medical care while trying to heal themselves just through alternative methods alone.
Which can be really dangerous.
And our sources give us such a powerful statement to help us reframe this, to break free from that kind of self-blame or judgment from others. They say, we need to stop using healthy as a shield. You can eat clean, juice daily, pray every morning, and still have cells go rogue. And that doesn't make you weak. That makes you human,
That's such a great quote. So grounding.
isn't it? It's profoundly important. It acknowledges the complex, sometimes just unpredictable nature of our biology. It strips away the judgment and replaces it with compassion and, well, reality.
And this brings us to an absolutely essential point about the indispensability of science.
Yeah.
Regardless of your lifestyle choices, your personal beliefs, your spiritual practices, everybody deserves the rigor and the insights that scientific understanding and medical intervention offer when you're faced with a serious health challenge like cancer.
Science has a crucial role, no matter what.
Absolutely. Dismissing science in favor of lifestyle alone, or assuming that holistic practices are a complete substitute for medical care, that can be just as dangerous, maybe even more so than the shame barrier we talked about earlier.
Right.
While integrative approaches, things that combine conventional and complementary therapies, can powerfully support well-being, help manage side effects, improve quality of life during treatment, they simply cannot replace the precision diagnostic tools, the targeted therapies, and the evidence-based treatment protocols of modern medicine for something like cancer.
They're complementary, not replacements.
Exactly. Science offers objective tools and proven methods for detection, diagnosis, and treatment that are vital, often the only paths to a cure or long-term management. Delaying conventional diagnosis or treatment because you're trying a purely lifestyle-based approach first, that can have tragic and irreversible consequences.
So this section really prompts us, doesn't it? Prompts you, the listener, to kind of reevaluate your own perceptions of health and illness.
It really should.
It invites us to foster a deeper sense of compassion, not just for others, but for ourselves too. By acknowledging the complex, multifaceted nature of disease, understanding it's not simply a direct result of personal choices or, moral failings, we can move beyond these simplistic, often really harmful narratives about personal responsibility.
Letting go of that blame.
Yeah. It's about recognizing that sometimes, despite our absolute best efforts, our bodies do unpredictable things.
Yeah.
And that doesn't make us less valuable or less strong. It just means we're human, operating within this vast, complex biological and environmental landscape. Okay, shifting our focus now. Let's pivot from identifying all these, deeply entrenched problems to actually exploring the solutions. Our sources make it incredibly clear that the ultimate goal, the critical next step, is to normalize conversations around breast health.
Making it normal, that's key.
Exactly. This isn't just about sharing facts. It's about making these discussions as commonplace, as comfortable, as totally routine as talking about periods or our daily skincare routines or even, our mental health these days.
Imagine that.
Right. Can you imagine a world where talking about doing a breast check is as natural and unnoteworthy as discussing the weather? And what are some of the practical steps, based on the sources, that could really lead to this normalization?
Well, that vision of normalcy is absolutely achievable, and it translates directly into incredibly practical, potentially life-saving habits. If we can make breast health chats a natural part of life, then checking our breasts can become as ingrained in routine as, say, brushing our teeth.
Like it's just something you do.
Exactly. You don't question whether to brush your teeth in the morning. It's just an automatic part of self-care. The goal is to cultivate that same automaticity, that same comfort around breast checks, make them a non-negotiable part of daily or weekly self-care, something done without any shame or hesitation.
How'd that look, practically?
It could mean incorporating a quick check into your shower routine, setting a recurring reminder on your phone, or just treating it with the same casual diligence as maybe checking your skin for new moles. It's all about demystifying and destigmatizing the act itself.
Taking the weirdness out of it.
Precisely. And a critical insight here is the absolutely crucial role of early education in making this big shift happen. Our sources really emphasize that we need to start teaching girls from a very young age that their bodies aren't secrets to be guarded or hidden away.
Starting young makes sense.
Instead, teach them that their bodies are sacred entities, worthy of understanding, worthy of care, and worthy of open discussion. This approach directly fights that shame barrier we talked about right at the beginning.
Undermining it from the start.
Exactly. Imagine a world where, anatomical terms for breast health are learned in school just like other body parts, where open conversations about changes or concerns are encouraged by parents and guardians, fostering a sense of ownership and curiosity instead of fear or embarrassment.
That would be a different world.
It would. By instilling this understanding early on, we empower future generations to approach their bodies with confidence and proactive care. We set them on a path of lifelong health advocacy for themselves. It's about building this foundation of self-awareness that inherently pushes back against that cultural silence.
This brings us to a really powerful contrast, one that our sources articulate so well. The stark difference in outcomes between keeping silent and actually speaking up.
It's night and day.
They state it so powerfully, it paints this vivid, almost chilling picture. When women whisper about symptoms in private, cancers grow in silence.
That really lands.
Doesn't it? It depicts that insidious growth of disease just silently thriving while crucial information stays suppressed, trapped by fear or maybe modesty. But then there's the empowering alternative. When we speak up, ask questions, and get curious, that's how we save lives.
Action versus inaction.
Exactly. This isn't just about individual agency. It's about using our collective voices as really potent tools for survival and prevention. The very act of voicing a concern, it transforms a private fear into a public pursuit of health. It opens up pathways to diagnosis and treatment that silence just slams shut.
Changes everything.
It's the difference between a hidden, lonely battle and a shared fight. And what's truly compelling here is the ripple effect this action can have. Your individual story, your personal willingness to speak up, to share your experience, or even just ask questions, it can have this profound collective impact way beyond your immediate circle.
It spreads outwards.
Our sources really emphasize this transformative ripple effect, reminding us that your story could be the one that wakes up someone else's survival.
Wow, that's powerful too.
It really highlights the incredible community aspect of health advocacy. It's not just about your personal health journey. It's about the collective empowerment that comes from sharing knowledge and supporting each other.
We help each other wake up.
Right. For example, your candid discussion about doing a self-exam might prompt a friend to finally check that lump they've been trying to ignore. Your decision to push for a second opinion might inspire someone else to advocate for themselves when a doctor dismisses them.
It creates momentum.
It creates this virtuous cycle of awareness, proactive care, and ultimately, it saves more lives. Every conversation, every act of courage, it can be a catalyst for others.
So this leads to a vital question for you listening right now to really consider deeply. How can you, starting today, concretely contribute to normalizing this conversation in your own life?
What can I do?
Exactly. Is it initiating open discussions with friends or family about breast health? Maybe sharing something you learned in this deep dive? Perhaps it's committing to regular self-checks and talking about it openly, making it a normal part of your routine.
Making it visible.
Or maybe it's sharing accurate information from reliable sources, like the insights we've explored today, on your social media or within your community groups. Could you advocate for better awareness or resources locally? Maybe support a local health initiative, or even write to your elected officials.
Lots of options.
Every small step towards openness, every word spoken, every piece of information shared is genuinely a step away from silence and towards a healthier, more informed future for absolutely everyone. Your voice truly, truly matters. #outro. So as we bring this deep dive to a close, let's just reiterate that core message that echoed so powerfully through all our sources. Breast health isn't just a women's issue.
So important to remember.
While yes, it predominantly affects women, its impact ripples through families, entire communities, healthcare systems all over the world. That makes it fundamentally, unequivocally, a global health issue.
Affects us all.
It does. And the pathway to change, as our sources powerfully direct us, it's clear, it's actionable. It's like a beacon towards a healthier future. The more we talk, the less we lose. The more we listen, the earlier we catch it. And the sooner we act, the more we heal together.
Talk, listen, act.
Together. Exactly. It's a collective responsibility, a crucial call to action for every single one of us. Doesn't matter your gender, background, or where you live. Ending the shame, breaking the silence. It isn't just some feel-good idea. It's a tangible, urgent strategy for saving lives and fostering healing on a truly global scale.
If you've made it all the way here with us, listening to every word of this deep dive, just take a moment to absorb that. You just experienced something, I think, truly profound and empowering.
Hopefully.
This wasn't just, a segment spitting out information. It was designed as this comprehensive exploration, a narrative trying to merge the critical signs, the evolving science, the pathways to healing, those nuanced hormonal truths we talked about, and the crucial cultural layers all into one cohesive story.
Connecting the dots.
We really worked to ensure you wouldn't miss that bigger picture, the interconnectedness of all these vital pieces. Our goal wasn't just to inform you, give you facts to chew on. It was really to empower you, to help you understand your body better than anyone else ever will.
That self-knowledge is key.
You now have the knowledge, the context, and hopefully the inspiration to take what you've learned and actually apply it. So go back if you need to, pause this, maybe journal, reflect on what really resonated most deeply with you.
Make it personal.
And most importantly, please consider sharing this knowledge. Talk to your sisters, your friends, your family, your community circles. Your voice matters so much here, and your sharing can truly make a difference in someone else's life. Remember, your body's been speaking to you, giving you signals all along. Now, finally, maybe you're listening, and that's where the healing, both personal and collective, truly begins.